Turn to Dr. Nesbitt, who is going to discuss our current metrics and share her assessment of what that means, what the trends mean, and what DC Health is closely monitoring.
And thank you, Madam Mayor. What you'll see before you are the metrics, some of the key metrics that we used in our decisions for reopening DC in terms of having a phase 1, phase 2, and phase 3. The majority of the significant indicators at this phase in the pandemic became green in late June, early July, and at that time the district moved into phase 3. You will note here that there are some indicators that are of key interest, in particular the daily case rate, that have now become yellow again, indicating that we have moderate transmission in the District of Columbia. One of the things that I'd like to highlight is that several months, likely 6 months or so before the CDC created a continuum for transmission and created metrics related to the daily case rate and the test positivity rate, meaning their continuum consists of low, moderate, substantial, and high transmission. The District of Columbia had already committed to 3 categories of transmission: low, moderate, and substantial. As such, there is overlap between what DC's metrics indicate to be moderate and transmission and the CDC's definitions of low and moderate, and then there is overlap between DC's moderate category and the CDC's substantial category. So you will be mindful of that when you are reviewing and trying to understand from a verbiage point of view where the District of Columbia is in transmission. As always, residents and visitors of the District of Columbia are advised to follow the recommendations of DC Health in terms of any mitigation strategies that may be in place as a result of our current level of community transmission. Next, you will see that since the beginning of July, where we had great case rates with minimal to community spread, where there were levels that we had not seen since the very beginning of the pandemic. Over the month of July, or throughout the month of July, we have seen a 5-fold increase in our daily case rate, where we are now at a daily case rate over 8. After having experienced lows nearly at 1.5 cases per 100,000 per day. We have provided for you a conversion of what our daily case rate is in terms of the CDC's weekly case rate for people who want to make that comparison, and it is currently at 58.15. What we know in terms of the trends that we are seeing is that the greatest increase in our cases is attributable to young people and young adults. In particular, we are seeing a higher number of cases and a higher proportion of our cases occurring in 5 to 14-year-olds and in the 20 to 34-year-old populations here in the District of Columbia. Some of the activities, as we have now again begun to see increased participation with our contact trace team, some of the activities that are noted by positive cases in the district that they have participated in that are now seeing an increase over the past month are travel, internationally and domestically, dining out, and social activities. We'll also note that for social activities, the size or the number of people in attendance at the social activity that a positive person has participated in is now skewing toward larger groups. Whereas you may recall last winter, we spoke a lot about people participating in small gatherings of less than 10 people. We also want to make sure that people understand the impact of these case rates on our test positivity rate, which is also beginning to increase, was previously minimal and is now moderate. We do continue to have a high degree of testing in the District of Columbia, both through our private, publicly operated sites and our private healthcare providers, and our test positivity rate is now at 3.6%, which also indicates moderate transmission in the district. I want to highlight before we go to vaccinations that we continue to see disparities in who is getting infected in the District of Columbia, both from a race and ethnic perspective as well as a geographic perspective. We have done a tremendous job in terms of reducing the amount of new cases that occur in people over 65. We have about a handful of cases every week in that population of people over age 65, and essentially no racial and ethnic disparities for that population. However, when we look at our younger people, 5 to 14-year-olds in particular, Black youth are 3 times more likely to be infected with COVID over the past couple of weeks than their white counterparts. So on the next slide, you'll see where we are in the district in terms of vaccine coverage for people aged 12 and older. All of this data continues to be available on coronavirus.dc.gov, where you can review and query our vaccination data from a number of perspectives. Here, we have provided you a graph of what coverage looks like in the District of Columbia, what fully vaccinated coverage looks like in the District of Columbia for our DC residents who are over 12 years of age, meaning the entire eligible population. Vaccine coverage is higher in wards 3, 4, and 6, and is lowest in wards 7 and 8. Again, driving many of these gaps in coverage are not our population that's over the age of 65. We see very little difference in race, ethnic, and even geographic distribution of coverage for the population over 65. For the young population, those who are eligible for vaccination, 12 to 15, the current coverage, meaning they've had at least one dose rather, of the vaccine for Black youth 12 to 15 is around 14%. But when compared to their white counterparts, the coverage is 51%. So a lot of the gap we see in coverage is attributable to youth and young adults and not to our seniors. That will have a great impact on us. As we recall, in the earlier months of the pandemic, most of our cases were in seniors, people who are middle-aged with chronic health conditions, requiring hospitalization and substantial care. And now the pandemic, just like it has nationally, is skewing younger. But I want people to be mindful that young people can get COVID-19. Children can get COVID-19, and children can be hospitalized for COVID-19. So it is not considered to be acceptable for us to take our foot off the gas because the pandemic is now skewing to the younger population. And with that, I'll turn it back over to you, Madam Mayor.
Thank you, Dr. Nesbitt, for that update. And we, of course, will be available for your questions. And DC Health has recommended that given the trends and cases that we see, and that we want to get ahead of it and nip it in the bud as best we can. And we know that masks can be very effective in doing that. So beginning this Saturday at 5 a.m., I will issue by mayor's order the directive that people over the age of 2 must wear a mask indoors regardless of their vaccination status. And I know that DC residents have been very closely following the public health guidelines, and they will embrace this. Our businesses will embrace it, and we will continue to do what is necessary to keep DC safe.